Hi, it's Richard from Cornwall Mind, and it's great to have Dr. Hilary Jones with us today. Hi, Dr. Hilary.
Nice to be here, Richard. Thank you.
Now, what can you tell us about the NHS Help Us Help You campaign?
Well, this is the ongoing campaign, and this one will focus on abdominal and urological cancer symptoms. We know that bowel cancer, kidney cancer, bladder cancer, ovarian cancer, things that people might describe as symptoms of tummy troubles, which are particularly persistent, account for about 44% of all cancers in England and account for 41% of deaths. So it's really important that people know what the suspicious symptoms of abdominal and urological cancers are. That's the focus of this campaign. But it's also to tell people that the NHS is prioritising cancer and that surgeries, GP surgeries and hospital clinics are open for business as usual. We've got through the early stages of the pandemic. We're COVID secure. We've got these cancer hubs, which are COVID secure. We've got staff there to prioritise cancer. And it's important that if you've got suspicious symptoms, that you come and see us. We're there to see you and we want to see you.
And what symptoms should people look out for which could be linked to cancers in these particular areas?
The most important ones would be any abdominal discomfort or diarrhea that lasts for more than 3 weeks, or seeing blood in your urine when you pee, even just the once. It's probably nothing. It's probably nothing serious at all. Many of these symptoms are accounted for by benign things which are self-limiting and of short duration. But you just never know. And it's just important to get them investigated and rule cancer out. Some people will be unfortunate enough to have early stages of cancer. But if it's caught in the early stages, the chances of having greater numbers of options for treatment and a better outcome are much greater. So the earlier we see you, the better.
And the prospect of a diagnosis and the results can really affect our mental health too. So would you say that we need to get support in that area as well when we're looking to see our GP?
Oh, absolutely. Worrying about things is very, very stressful and distressing. It affects people's sleep. It affects people's confidence. It affects people's ability to carry on working and enjoying normal relationships. So another reason to go along and get the reassurance that you will almost certainly get. I would say that, there have been anxieties and worries about going to see doctors during the pandemic, not wanting to be a waste of time or not wanting to expose themselves to any risk of COVID. But we're through that. Cancer hubs are COVID-19 secure. We take extra precautions, and it's really important that we are able to prioritise cancer patients and get them seen quickly. It's amazing that since March of 2020, 381,000 cancer patients have started their treatment, and 95% of them started their treatment within 21 days of the decision being made to treat. And that's magnificent. And it just goes to show that cancer investigations now are continuing just as they did before the pandemic. And that's highly reassuring.
I imagine getting an early diagnosis is also really important. But for what other reasons should we get these symptoms checked out by our doctor?
Yeah, very much so. There was a survey conducted by NHS England, which was really interesting, confirms everything that I've known as a GP for many years. 74% of people said that they didn't want to worry their friends or family. And that's why they didn't report the symptoms. 50% said they were even reluctant to see their GP out of embarrassment or not wanting to waste their time. And here's the thing, 71% said they would only go and see their GP if they thought their symptoms were serious. And yet a third of them didn't know what serious symptoms really meant. So knowing about the symptoms, not just persistent diarrhea or abdominal pain and blood in the urine, but other symptoms such as unexplained weight loss, feeling a lump in your tummy, bleeding after the menopause, vaginal bleeding, after the menopause, other symptoms, blood in the motions, persistent bloating. It's important not to put these symptoms down to something trivial or anything else, or just wait a bit longer. Go and see your GP as soon as possible.
And for those that may be concerned about themselves or others, where can they go to get more information?
Yeah, they can go to nhs.uk/cancer symptoms for more information.
That's great. Dr. Hilary Jones, thank you so much for joining us today.
My pleasure. You take care now.